Hi everyone, my name is Sandeep Alur and Microsoft India head this group called Microsoft Technology Center. Today I'm here to talk about two experiences. You can term them as two applications for the future. In fact, they're here and now, and I thought I'll take this opportunity to kind of share them with a glimpse of what is art of the possible when it comes to these two streams. Stream number one, mixed reality. Yes, you see the HoloLens right here. I'm going to take you through how this technology, which is mixed reality, and the power of this head-mounted device, which is HoloLens, can help clinicians, doctors, even patients for that matter, understand some of the technicality when it comes to health in a very immersive fashion, leading to better outcomes, right? That's number one. Number two, conversation AI. Yes, in the current times, when it comes to a patient-doctor interaction, there is significant amount of documentation a clinician has to do as part of the conversation. It becomes quite a task, end of the day, for the doctor to kind of start keying information, be it the diagnosis or even the outcome for that part and the prescription. So globally, it's been proven that doctors, clinicians, etc., they go with a lot of fatigue when it comes to documentation. This is where technology can make a difference. Yeah. So number one, mixed reality. Number two, conversation AI. We'll get right into it. But before that, I thought I'll share a quick, I would say, narrative. Yes, as Microsoft, we've been innovating for a long time when it comes to making it easier, simpler when for technology for healthcare. How can we help the healthcare industry evolve, leveraging the power of digital technologies? And this is where we talk about, I would say, three pivots. Number one, enabling personalized healthcare, right? For a patient, how can we kind of, establish a bridge where patient can communicate with healthcare provider at ease, anytime, during any device. That's number one. Number two, how can we empower care teams? See, eventually, the people on the floor, when they deal with the patients, they need to have access to data, they need access to patient information, they need to have access to their colleagues, right, in terms of communication, and they have to effectively collaborate to work towards a positive outcome, and that's where empowering care team becomes very critical. Number three, of course, clinical analytics, right? Data is all over the place. The question is, how do we kind of bring it all together to make meaningful sense, and the insights will supremely help a healthcare provider to predict for the future. Of course, there is descriptive statistics and predictive, and dominantly using the power of data, you understand what has happened in the past, but important to also predict what may happen in the future when it comes to clinical outcomes. Yeah. So without much ado, let's jump right in. I'm going to take you through the first experience. This is an experience built by one of our customers in the US, Case Western Reserve University. This is a classic example of how can technology come in handy when it comes to some of the adversity that we go through. So in the last 2 years, because of pandemic, in this medical school, Case Western Reserve University, they could not let students enter cadaver lab for obvious reasons, COVID, right? So how can you teach anatomy without somebody going through a cadaver lab was a challenge. That's where they brought in the power of mixed reality. So what you're going to see right now is an application called Holo Anatomy, which is, in my view, one of the best visualization of anatomy. And let's go through this. The intent here is to see how the experience can be made real, immersive, and yet augment learning. So a lot of doctors that we have kind of shown this to, the first impression from them is, wish we had something like this when we were learning medicine. Our learning would have been faster, and our relatability to anatomy would be much more nicer, right? So let's go through this, and I'm going to wear this HoloLens and take you through the first experience, which is Holo Anatomy, and what you're able to see now is a view from my HoloLens. Yeah, let's get right in. Okay, so let me bring up the Holo Anatomy application. Yes, what you're seeing right now is a skeletal view, a hologram. Again, as I said earlier, this is an app built by Case Western Reserve University to aid students learn anatomy in a much immersive fashion. I can go around, have a very, very immersive experience of looking at anatomy up close. And this is like a slideshow, by the way. I'm going to move to the next slide. Tap on this. Yes, this is basically musculoskeletal system. As you see the caption right on the bottom. And I can move forward, and this is again musculoskeletal groups, right? I can this is great way of understanding what is what. It's all captioned brilliantly. And the best part is, you can go around. It's not just a 2D. It's not a 2D view. It's a 3-dimensional view. So it's as good as seeing a real. I would say in a cadaver lab, how you would see it. It's as good as that. I'm going to go around. Right. I can sit in any posture, look at it, and they're all captioned really well. And in fact, there's also another version where it offers a quiz on the anatomy. So it points to specific organ you're supposed to kind of choose the right name for that. Again, look, this is the beauty, right? So the hologram can be any size. So this is digestive system and kidneys. So it's at my eye level, ease of use, ease of experiencing what is what up close, right? And soon I'll switch to a horizontal view because you need to look at anatomy in different perspectives. So as you see on the screen right now, I'm kind of going around to the entire length of anatomy here. In fact, if I want to see underneath, I can just bend down and look at that perspective as well. So it's as real as it can get in terms of an experience of looking at holograms, specifically when it comes to mixed reality, right? So the best part is it's mixed reality. So I can see the physical world and the virtual world in unison. This is the nervous system. Yeah. So pretty much, this is truly an application of the future. And again, as I said earlier, this is from Case Western University. With that, awesome. So what you just saw was a quick glimpse of the anatomy application. Of course, this was non-interactive, right? There is another version of the same application which is interactive. That means I'll be able to kind of move things around. For example, if I want to go layer by layer in terms of understanding anatomy in a much better fashion, you could do that. In fact, you can actually remove certain parts and assemble it back, right? It's almost like a jigsaw puzzle. You can do that. So this is the true power of how immersive experiences, right? This end of the day, it's all about experience. One of the key thematic for this decade, as called by a lot of analysts, is total experience, and this is probably one of the best example of how we can empower students, doctors, and nurses to understand visualization in a much immersive fashion, leading to better outcomes. Yeah, this is the first one. Let's move to the second one. Second is the interesting one in my view, because today we talk about the fatigue when it comes to clinicians related to documentation. So documentation is not easy, right? When it comes to seeing, let's say, 20 patients a day or 100 patients a day, equal amount of work is involved to document it. Documentation is the only source by which you can refer back to historical data. And also when it comes to audit trail, it's critical, because at the end of the day there is a regulatory compliance. So you have to document it and ensure that the right prescription and remedial actions are all documented, and eventually prescriptions given through that, right? So globally, the statistics say that yes, there's significant fatigue among clinicians when it comes to documentation, and this is where the power of tech can come in handy. So one of our newest innovation, I would say, there's an acquisition we did as Microsoft called Nuance, and what I'm going to show you is a conversation AI. It's a conversation between a doctor and a patient. Of course, right now the scenario is the conversation has happened between the doctor and a patient. Now the doctor has to document. So how can we help the doctor, using the power of speech, document everything that transpired in the conversation in terms of what was the diagnosis, what's the prescription, and eventually save that and submit it back to the system. That means without much of a keyboard usage when it comes to typing in, can speech come in handy for doctors to just speak, and the system understands everything you're speaking, be it the vocabulary using, which is dominant healthcare here, the speed at which you speak, the accuracy of collecting information. I mean, that matters the most. So if you look at generally the conversation AI, dominantly what we've seen globally is generic speech models, right? Many times, by the way, I'm a very fast speaker. You might notice it. I'm trying my best to speak slow, but when I speak fast, many times the generic speech models fail to capture my words at times, because it's trained on a generic mode. But the Nuance Dragon Medical One solution, which I'm going to show, that's very, very accurate when it comes to capturing the voice, the speech at certain speed, right? I can speak fast, I can speak slow, it is magic. It's magical. So I will take you through this demonstration right away. So what you will see right now would be an application which is a simulation of a mic. I'm going to switch on the mic on my machine and start reading out a script. I have the script on my phone right now. So for ease of demonstration, I have the script here. I'm going to read out at a certain space, and let's see how easily, how brilliantly, in fact, this technology captures my speech and convert that into a text. This is a classic evidence of how you can help clinicians to documentation in real time. So let's switch over to my desktop, and you should watch this to see the real magic. Awesome. So as you see on the screen right now, you have a Dragon Medical One listener. That's a speech module which listens to a conversation. I'm going to enable the mic and start speaking, and just follow how this conversation happens between the doctor and this speech capture in terms of documentation. Yeah, let's get going. I'm going to click on start, insert allergy template. Allergic asthma. Next field. Okay. So now what you will witness is I'm going to speak at a certain speed, right? I'm going to go fast and slow, and just look at how accurately it kind of captures the text. Yeah, let's get going. Mark Adams is a 58-year-old male who presents for evaluation of newly diagnosed allergic asthma period. He reports that the asthma symptoms have gotten worse over the last year since he moved into a rural area, period. The patient reports mild shortness of breath, which gets worse over time, waking up at night several times a week, occasional wheezing, mild chest tightness, watery eyes and runny nose, period. Yeah, you saw that I spoke at a certain speed, and you could capture without an issue at all, with all 100% accuracy. It's so accurate, right? Let's move forward. He uses an inhaler when symptoms get worse, period. Patient denies cough, phlegm, rash, nausea, vomiting, throat swelling, or lack of activities or energy, period. Select watery eyes. Scratch that. Yeah, so what you just saw was, yes, there were some mistakes while I spoke, and I could correct it with, again, speech commands. Yeah, let's move forward. Next field. No audible stridor. Next field. Faint wheezing bilaterally in all lung fields. Next field. So this is going to be the final prescription, right? Let me read it out and we'll take it from there. Allergic asthma : patient will continue inhaler use as needed, period. I will also prescribe Singulair 10 milligrams once daily, period. Patient referred to for skin allergy testing to identify the allergen, period. If skin testing does not identify the allergen, further blood testing to follow, period. Yeah. So what you just saw was a classic evidence of how seamlessly the doctor's speech gets captured by Dragon Medical One solution from Nuance, and this is again a classic example of conversation AI. Awesome. So wasn't that cool? So what you saw was a classic evidence of how speech can be converted to text in real time, and this is definitely a blessing in disguise, because today, as I said earlier, one of the biggest problem area for doctors is fatigue leading to documentation, and that's not easy end of the day, right? So you see a patient, you also have to spend good time documentation, so that leads fatigue. So this is a technology which is going to help doctors seamlessly go through this experience of documentation with utmost ease. Yeah. So what we just saw was two experiences. One is, of course, the art of the possible when it comes to mixed reality, holograms in the field of medicine, and trust me, this one, converting, let's say, a CT scan or MRI into three-dimensional model is where the industry is moving towards right now. So we're working with a lot of customers right now as we speak, and the biggest feedback we've got is, wow, this is great, because we were restricted to the two-dimensional view. Despite you doing 3D, if you're seeing a flat screen, it's still 2D, right? So this technology, mixed reality, is helping us look at a holistic perspective of let's say a CT scan or MRI. We're able to understand things better and leading to better outcomes, right? When it comes to mixed reality, yes, we're talking about holograms, we're talking about remote assistance, bridging the skill gap, simulation, training, contextual overlay, and the example you saw was 3D visualization for immersive experiences. Yeah, the second one was about conversation AI. So user to experiences, these are here and now for sure, right? While we say applications of the future, this is something which can be adopted right away, and this is a great opportunity for you to look at these scenarios and see how we can empower healthcare industry with solutions which matter most to them right now, leading to better clinical outcomes. With that, thank you so much for watching, and have a wonderful Future Ready Application Summit. Bye-bye.